Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be talking about one of the 8th most common beginner ISTDP practitioner mistakes, which is not focusing enough on building structure. Let's get started. All right, so what do I mean by building structure? Building structure in a patient is one of the key components of a graded format of ISTDP therapy. Essentially, it means that your patient does not have the anxiety regulatory capacity to deal with high pressure therapy. You need essentially for this patient to build enough structure in them, enough cognitive structure, enough of an understanding for your patient to be able to look and feel and explore in places where you want them to be able to look and feel and explore. So one thing that I've noticed is that my students and myself as well, again, when I started, it was kind of like building structure was almost seen as something that was kind of flippant. You do it for 5 minutes because I was so eager, and you might be too, to get into those feelings, to get into those kind of unlockings, that you might find yourself skipping past some of the core and key features of ISTDP. One reason that ISTDP works not just with a sort of a specific population is because it is so diverse. It's because it's so flexible and it's so adaptable based on what your patient brings in. So building structure and spending a lot of time building structure is a core component, a key component of ISTDP therapy. Now, different therapists do this in different ways, but the key factor, what you're trying to do when you are building structure in a patient, is to build more understanding and healthier, more functional defenses, if you will, and to give the patient a sense that they can handle more of what is unconscious. And to do that, in short, if we want to look at what research says about that, it really means that we're helping your patient activate their frontal lobe. We're helping your patient develop a stronger left prefrontal cortex activity so that it can regulate the limbic cortical system activity. What does that mean? It means we're helping them turn on their thinking ability so that their thinking ability can operate simultaneously as their emotions are firing, so that they are better able to regulate themselves while in therapy with you. So here are some things not to do when you are working on building capacity with your patients. First of all, a patient that does not have capacity, you don't want to be blocking their defenses. You want to be doing minimal to no defense blocking, because the patient's defenses are all they have in that moment to have any form of regulatory capacity. You block their defenses in a fragile patient, a patient who does not have structure, and all you're going to find is that now you're working with CPD. And if you're not noticing that you're working with CPD, before you know it, you might be CPDing yourself, and it becomes a mess of a session. So you're better off not blocking any defenses and simply focusing with your patient on understanding what's going on for them in those moments. Now, there are different ways to do this. I use a quite cognitive approach to understanding what's going on for them. And what I mean by that is I walk around the triangles a lot. I traverse the two triangles a lot. I might be going, so you're anxious now. And it seems like when you're anxious, you kind of get projective. And as you get projective, that seems like it kind of means to reduce your anxiety in some form. But we can see that it doesn't do that. And it might be some feelings that underlie that projection. And at the same time, we can see that this projection and these feelings and this anxiety happens for you with your partner, and it happens for you with other people. It happened for you in the past. It happens with you differently with men as it does with women. It happens for you with women differently as it does with children. It happens for you with old differently as it does with young. and so on and so forth. So I'm helping them really explore their defensive structure and explore the anxiety that they have and explore the feelings that they have beneath all that without pushing for those feelings to come up in the absence of the defense. So if you look at, for example, Alan Abbas's work, one of the things that he does is he does bracing, meaning that he essentially just kind of looks at, invites the patient, if you will, to look at the feeling that they have underneath without removing their defenses. So he might kind of go, what are the feelings that you have? And the patient might put up a massive defense. And he doesn't kind of go, well, if you see that, can you see how that's harmful to you? Don't do that, stop that, and all that jazz. He just kind of really goes back to, okay, so what was the feeling again that you had there? Can we try to understand that? And then the patient might kind of say, maybe a little bit of anger. Could say, okay, so we can see that little bit of anger that you have kind of in a way causes your anxiety. You become anxious here with me because you're angry. And it might seem that in that way, your anger is kind of related to your anxiety. Can you see that? Do you want to keep looking at that anger? Because it seems like it's related to your anxiety, and that's kind of what makes you defense X. And then you put in the defense X there. So that's kind of one way to keep looking at that over and over and over and over and over again. I cannot emphasize enough how many sessions I've seen by master therapists where they're sitting and just building structure with a patient for 10, 20, 30, 40, 50, 60 sessions, just helping the patient build structure until the patient has enough structure that they can go further. And what I mean by that is you sit with your patient and you help them build structure until you see structure. That's going to be much more useful to you than you sitting and building structure until you think that should be enough and this is probably not, they should move along by now. So it's extremely helpful for a patient who's fragile, who doesn't have structure, just to build structure. If you can just achieve that, if you can just help them have more solid defensive structure, if you can help them have more solid affect regulation, if you can help them have more solid affect isolation, that in itself is helping the patient move miles and miles and miles ahead in therapy. You don't have to achieve what the master therapists can sometimes achieve in a very short number of sessions. Even the master therapist will tell you as well, when they're presenting how to work with the patient, they're presenting kind of the best case scenario for your learning purposes. A patient that would be useful for your learning, that they're not just sitting there showing you 20 sessions of talking about or building structure over and over and over again. Whenever I do teaching as well, it helps to use those patients who moved along after a little while, where you can kind of sit on something for 30 minutes and you can see a change, and after that change, you can move on into the next bit. It's useful for teaching, but don't believe that that's everything that happens with every single patient that I have. I know that it's impossible that even any of the master therapists are helping a person who has, for example, traumatic schizophrenia, build sufficient structure within a session or two. It just doesn't happen. So you need to kind of be aware that for a lot of patients, we have to sit on very useful and helpful and therapeutic concepts for a long time before we move on. If you can do that, and if you can follow your patient as opposed to follow your eagerness to do what I used to do, which is, dig for anger, which is I just love to kind of get in there into that anger and the love and the unlockings and the theatrical nature of it all. And, this kind of big revelation, it just feels really good because you help a person so swiftly and so effectively. But it doesn't mean that that is all we do, and it doesn't mean that that is what we have to do, even though our patient is clearly showing us that they're not ready and they need some structure first. I hope this video was helpful to you. I hope you can go now and reflect on your own therapy and how you can improve your structure building with the patient. Just circling around those two triangles will be very useful. Do that often, do that much more often, and do not block defenses when you see a fragile patient. Help them build structure, build a better or more healthy defensive structure, and you will find that your patients will actually move along faster than if you don't. Please subscribe to this channel. Help me out by subscribing. Please press that bell button. Let your friends know, anyone you know who hasn't seen these videos, let them know that there's a guy out here who's trying to do something useful. And if they're a therapist, even if they're not an ISTDP therapist, they might be able to relate to these videos as well. So let them know. Thank you so much, and I'll see you again for the next one.